Okay, so now we're talking more about some variabilities. One of the variability patterns is the S pattern, which literally makes an S shape on your monitor strip. It is typically equal amounts above and below your baseline heart rate. So it'll be, if it's 145, it'll be 150 above, and then it'll be 140 below, and it will make the S pattern. This is considered ominous, which again is a warning sign that there's an issue if there are no XLs with it. One of the reasons that you can see this is with RH factor sensitization or asphyxia. Also, you can see it with hypoxia and anemia. Typically, if it's a maternal thing, you'll see with abruption of the placenta. Also, another S pattern that you can see is saltatory. However, it is very rare. You don't see it very often, but it will literally be up, down, up, down, up, down, up, down with rapid fetal heart rate. That's kind of the key there, is that it's rapid fetal heart rate. The next thing that is mentioned in our notes is the monitoring equipment. The monitoring equipment that is used just for uterine contractions are what's called the TOCO, which is Latin, and it literally means to give birth. That is going to be what you have on the outside of mom's belly or over her fundus, and it's always going to be external and measure the contractions. It cannot measure true intensity, and it can be affected by the movement of the baby and the placement of the baby. It can be used before the membranes rupture. Now, the other uterine contraction equipment that is used for monitoring is the IUPC, which is intrauterine. This only the doctor can apply. And like our instructors told us, that's important so that there are no complications caused by this, such as a tear in the uterus and all those other things that can happen. Just like the scalp monitor, the membranes have to have ruptured, and the mom has to be dilated to at least a 2. Also, with this one, they want the baby to be at a -1 station. And if you're not familiar with your stations, your -1 is going to be right above your ischial spines. Hope I said that right. The thing with this is that it will actually monitor the strength of the contractions. So they're not typically used, but if they are, they can tell the doctor how well the contractions are working. Some of the things that reasons you can't use it are placenta previa, obviously, because you're not going to be able to get it up where it needs to go, and you can hurt the placenta, and also infection, that sort of thing. One of the things that they taught us to be able to tell how hard the contraction is working, the terms that they use are either mild, moderate, or strong, or hard. So you're going to do the face test. Your nose is going to be mild, your chin is going to be moderate, and then your forehead is hard or strong, and that tells you how hard the contraction is. Just an easy way to document how hard mom is contracting. Temporary changes in accelerations. That's going to be 15 beats per minute above baseline, lasting 15 seconds or more. So the change of the accelerations, anytime you have an acceleration, it is typically normal. It's not any type of concern. Just means that baby's heart rate's changing, going up a little bit. If it's periodic again, that means it is in correlation with a contraction. Non-periodic means has nothing to do with a contraction. Now we're going to talk about D cells. If you have an early D cell, that's okay, typically. And we'll talk about terms in a little bit, but it is usually caused by head compression. And again, you're going to use the coil, or excuse me, you're going to turn mom or put mom in Trendelenburg, which is going to take off the pressure off of the head, typically. It's considered normal for early D cells if the mom has dilated to from a 4 to 7 centimeters. That's considered normal. If she is between 0 to 3, she is considered, that may indicate that the baby has CPD, and which stands for cephalopelvic disproportion, which essentially just means baby's way too big to come down out of the pelvis. Your nursing interventions are going to let mom know that it's okay, give her some reassurance, document what's going on. And again, like I said, one of the simple ways, you can change positions or put mom in Trendelenburg. Let's see. Now we're going to talk about late D cells. One of the cartoons that we were given was a couple going to dinner. Said it's okay if you're early to dinner, but never okay if you're late. That's because late D cells are bad. They're never good. They're never an okay thing. One of the things that you want to watch for on your D cells is your variability. Like I said, anytime you see a decrease in variability, that's a bad sign. If you have late D cells and decreased variability, that's when you're really going to be concerned. Again, you're going to change mom's position. This is where they talk about coil. Coil, the first one, C, is for change positions. Again, this can help a lot of different things. So mom's going to change, you're going to change mom's position. They say to put her on her left. I don't think it really matters. You just want to change positions to see if that will help get baby off of cord, baby off of head, whatever. The O, oxytocin. If you're having late D cells and mom is on oxytocin, you're going to stop the oxytocin. It also stands for oxygen. You're going to deliver oxygen to mom. I is for IV fluids. IV fluids are important because they help to increase circulation and they can help raise the blood pressure if the blood pressure has dropped. L is to lower the head of the bed. Again, like I said, that is the position called Trendelenburg. That is important because it takes pressure off of baby from the pelvis. Gravity is great, right? Okay, so some more about some variables. It says you'll see variables and this is a little different than the variability. Your variability is going to be the movement or the lines, the variability lines that you see in your strip. Variables will be typically a very pronounced shape, a U, V, or a W that you'll see in your strip. It doesn't always mean that there's a bad thing going on, but it is typically common in your D cell. So, again, with your any type of D cell, you want to watch for the variability. Anytime there's a decrease in the variability, that's a bad sign. Usually when you have a variable D cell, that is cord compression. Again, you're going to use the coil method. Change positions, give oxygen, decrease or stop the oxytocin altogether, IV fluids, and again, Trendelenburg. You're going to lay the head of the bed back. One of the acronyms that I really like that they gave us was VILCHOP. That tells you the certain types of variabilities and what to do for each one. The V is for variable D cells, and which means that there's cord compression. That's where you get the C. E is for early D cells, which is indicative of head compression. A is for acceleration, which is okay. Means there's nothing wrong, completely normal. L, late decels, very bad, which means there's placental insufficiency. Again, one of the things that I wanted to stress is that for almost all of these, you can change mom's position. That's always going to help. And a lot of times if you put mom in Trendelenburg, it will help. Okay, so some of the things, the points that they wanted you to know was that some of the warning signs are, again, like I've said over and over again, anytime there's a decrease in the variability, that's a warning sign. Anytime that they have progressive tachycardia, which means that it is continuous, that's a warning sign. Anytime that the baseline fetal heart rate is continuously goes down, that's a warning sign, What's considered ominous is your persistent late decels. Pretty much anytime you have recurrent late decels, that's a really bad sign. And then when you have the decreasing variability with it, that's when you need to be calling your doctor and getting things rolling, see what you can do to help baby. Okay, I think I've gone over most everything. This is the our first lecture over fetal well-being, and if you have any questions, just put them in and I'll try to answer them as best as I can. Thanks.
If you liked the video, give it a like and subscribe.